AHP. Is it for me?
I really enjoy the job. I love to help people.
It can somewhat become a pleasurable experience for both myself and the patient as we get to know each other a bit more and build rapport.
This career can be very challenging, but it can also be so rewarding.
You've got an opportunity to think of new and exciting ways to help them.
I feel really good when I help someone do things that they really want to do.
When a patient says to me, "Oh, I really didn't know that," that's been really helpful.
Every day is different. I meet so many different people from all walks of life.
It's the best decision that I've made, and I really do enjoy the job.
I bet you think the NHS is all about doctors, nurses and hospitals, but there's an army of skillful and dedicated practitioners who play a vital role across our health service. They're called Allied Health Professionals, or AHPs for short, and they're the third largest workforce in the health service. There are over 150,000 within the NHS, working in hospitals, community sites, patient homes and even schools. They're helping to change people's lives for the better. There are 14 different health professions. You could be an occupational therapist, a radiographer, a physiotherapist, an operating department practitioner, a speech and language therapist, or so much more. As an AHP, you could be working as any one of a huge range of fantastic roles. Let's meet some of the AHPs that work at Royal Wolverhampton NHS Trust to find out more about what they do, why they chose to do it, and who they work with.
Hi, my name's Ben. I'm a senior physiotherapist. There are, in general, in physiotherapy, there are lots of different areas to work in. There's such a range of interests. So you've got things like orthopedics, which is broken bones. You've got respiratory, which is treating people's chests. You've got neurological conditions, which are conditions such as stroke. It's not just one thing. There are lots of things that you can branch out to. We have to communicate with a variety of different people, a lot of different people, whether it's children, whether it's adults, whether it's those who have difficulty communicating themselves. So we have to adapt to a variety of situations. It's also really helpful to be really friendly in that environment, supportive in helping our patients to achieve their goals. There are lots of different avenues you can go into once you become involved in physiotherapy. You can certainly go into very advanced clinical roles, which basically means treating patients, specialised patients at a different level. You can go into management roles, so that involves managing teams or helping restructure the organisation. There are different avenues such as going down the university route, whether you want to go into education or lecturing. There are lots of different aspects that you can go down as you build on your career. The entry requirements for physiotherapy are usually 3 A to C grades at A level, which would then have entry requirements into a university course. A lot of people are usually interested in going to do physiotherapy from a sports background, but what I would recommend to you is that you try and find some work experience, whether that's at a local clinic or your local NHS trust. It's really important to go and see the different aspects of physiotherapy, and for when you go to university it will open your mind to the lots of different areas that physiotherapy involves. The thing that resonates most with me is the satisfaction we get out of our job. Just to see, certainly for myself, when I've treated some of the children that I see, that smile that comes back onto their face, the fact that they're able to move around and do what they want to do, and certainly involving that with their parents, their reaction is absolutely brilliant. In terms of pay and structure, it is helpful, and as you progress in your career you can climb up those ladders, but I think from being a physiotherapy for 7-8 years now, the satisfaction of getting patients back on their feet, rehabilitating them to their levels that they were before, there's no better feeling.
My name is Helena Doughty and I'm a newly qualified dietitian. So on a day-to-day basis, we get a number of referrals from the ward to review patients for oral nutrition support. So that's about giving them nutritional supplements, or we get referrals for patients who require feeding tubes. So that's when they either have a tube put into their tummy and we feed them directly into their tummy, or we feed them up through their nose and into the stomach. We might educate patients on eating and drinking a healthier diet. We might educate patients if they need a gluten-free diet, so if they have celiac disease or if they have liver disease. Dietetics is a wide variety of things that you can do. The reason I became a dietitian is because one of my friends was actually suffering from anorexia. And at the time I just didn't know how to help her, how to support her, what to do. So I actually started researching. So I did a BTEC in medical science at Wolverhampton College and an A-level. Generically what most people do is they would do 3 A-levels. So they would do it in a biology, a psychology, and then maybe like a chemistry. And you can either do an undergrad degree, so the local ones around here would be like Coventry or Chester. Or I did a postgrad, so I did like an 18 months kind of like top up to a nutrition degree that I'd already got. One of the other really good things that I suggest people do is maybe go on an experience day with a bunch of dietitians, so you can really see what we do and what the job is like, and there's loads of those available. One of the other bits of training that I did is I was actually a dietetic support worker for about 4 years, and that really gave me an insight into what it's like to work on a ward, the smells that you might get on a ward, and how a hospital really works, and that benefited me then also in terms of applying for a degree, because you've already got the experience there and you know what it feels like to work in a hospital. You've definitely got to be quite chatty. Because a lot of the patients who we have want to talk to you, they want to chat to you, and that's also, you've also got to be able to be empathetic and quite understanding with people. So understanding their situation, what they're going through. You've got to be confident enough to challenge people. So you've got to be confident enough to challenge doctors and say that you don't think what they're doing is right, maybe they should do it this way, because we are the experts in nutrition. In terms of like skills, I think you really need to be able to be a good communicator. So a lot of the things that we do in clinic is communicating. The way that we educate patients is all about our communication skills and having active listening skills, but that's something that I learned as part of my degree. It's not something that I just had. My job role at the moment is started off at an entry-level dietitian. So this is like a band 5 generic role where we work across all the different wards. But to progress, one of the things that you can do is go into a different specialism. So that might be specialisms where they just work with children. And they just work with children who have Kale's milk protein allergies, or you might just work with patients who have alcoholic liver disease, or they have problems with their bowels, or you might just work with cancer patients. And then from those different specialisms, the next level up then I suppose would be like management, where you could learn skills in management, and then you could progress maybe from there to a head of department. So whilst at the moment I earn £25,000, with additional training there is potential to earn a lot more. I do this role because I enjoy working with patients. Even if they've just taken a snippet of the information that I've given them, if they felt like it's changed their life in some sort of way and has benefited them, that is the satisfaction for me. The satisfaction is helping people and being there to support people.
My name's Enya Powell and I'm a therapeutic radiographer. Our job mainly involves is treating adults. In some departments you may come across treating paediatric patients, which are children, but here it's just strictly adults that we treat. On a day-to-day basis, our job involves us setting up a multitude of patients over different sites of the body. This could involve us treating pelvis patients for prostate cancers, breast cancer. The entry requirements at some universities tend to be 3 Bs, or they could be the equivalent to 180 to 240 credits. I know in terms of entering the course, you can either take the course of doing BTEC qualifications or you could do A-levels. It's important to be patient, to be kind, to be considerate on a daily basis. The patients that we get coming into the department every day are from different backgrounds. The experiences that they have are very varying for each patient. It's just great to be enthusiastic all the time and just be attentive to the patients that I attend. After a couple of years of experience, the career can see you taking either that avenue of management or becoming more advanced in a clinical role, eventually taking to the role of a consultant radiographer. I get plenty of job satisfaction, especially the challenges of the different patients that come and seeing how they progress from when they first start treatment towards the end. A lot of patients do attend that are quite nervous, and once they're about halfway through, they become more at ease. I encourage plenty of people to join this profession simply because of the mixture of patient care and the technology advancements that do take place. Over the past 5 years, the technology that we've seen evolve is just beyond what's fathomable, and it's only ever going to get even greater. And to be a part of such a movement to help treat cancer for patients is rewarding in itself, and it's something that I would like to remain in for a very long time.
Hi, my name's Selina. I'm a senior specialist podiatrist based at the Phoenix Health Centre. So the role of a podiatrist is to look after people's feet, so it's the foot and the lower limb. The role is varying. We can do general podiatry care, which is nail cutting and corns and callus care, but the majority of my work is a specialist role looking after patients with severe wounds that can lead to amputations. So this is applying certain dressings to make sure that the wound heals and that we don't result in people losing their feet or their leg. Podiatry is a very varying profession. On my day-to-day role, I will do basic podiatry care, but I could be involved in nail surgery, so doing minor ops, removing toenails. I could be working alongside other professionals like physiotherapists, nurses, district nurses and tissue viability nurses. So you could go into surgery, you could go into working with medical reps. Podiatrists need to be empathetic, they need to be supportive, caring, kind. You need to be organised because you will organise your clinical caseload yourself, and you need to be able to work as part of a team, be friendly and be happy. The entry requirements are 5 GCSEs including English language, maths and science-based subjects. Also required are A-levels, 3 subjects including the science-based ones. You may be able to enter with BTEC or HND subjects as well. What I get from podiatry is it's job satisfaction. My patients walk out feeling better, and it's most rewarding trying to get somebody to heal. The job is very well paid in terms of the NHS pay scale. You're supported from all your colleagues, and there is good career progression within the team. Feet aren't the most glamorous part of the body to be touching, but you wear gloves, you wear aprons, you don't have to touch anybody without being protected. You see the immediate effect of the treatment that you've administered to the patient, so as soon as they leave they will say, "My feet feel fantastic, thank you."
My name's Suki. I'm one of the orthoptists based at New Cross. I'm a highly specialist orthoptist. On a day-to-day basis, the job entails seeing patients of different ages, different abilities. It tends to be patients that might have a squint, which is where the eyes aren't pointing in the same direction, or they might have reduced vision. The entry requirements are typically 3 Bs. So at the moment there's 3 universities that offer the course. That's Liverpool, Sheffield and Glasgow. And they tend to ask for biology as one of the subjects as well. Aside from qualifications, there are so many other skills that you would need for the role. So being caring, having empathy, being a good team player. Orthoptists do work as part of a wider team within the eye hospital, so being able to work closely with the doctors, nurses, ophthalmic technicians and some of the admin staff, and not just those in the eye infirmary within the eye care team, but people in other areas of the hospitals as well. So when we work on the stroke unit, we do work quite closely with the physiotherapists and occupational therapists too. In terms of career progression, as a newly qualified orthoptist, you'll typically be seeing your bread and butter type of patients, but as you progress and sort of learn more skills, you'll be able to go into more extended roles and more specialist clinics. There's a whole scope of things that you can go into. As orthoptists, we do work as autonomous practitioners, so we use our knowledge to decide on a patient's care pathway. We don't have to rely on anybody else to make those decisions for us. It can be quite rewarding when patients' vision improves or all of a sudden they can lead more independent lives. Financially, orthoptics is a great career to be in, so typically as a new graduate you'd be starting on about £24,000, which is as a band 5. There's lots of scope for progression into band 6, band 7 and hopefully band 8 as well. That's typically your heads of department and you'd be earning around 50k plus. There's lots of opportunity to learn something new. It doesn't just stop at once you've got your degree, you can continue learning afterwards. I'd never heard of orthoptics before I applied. It's something that was mentioned to me and so I did sort of just fall into it, and I think I was very lucky to do so, as I wouldn't go back on it now. It's the best decision that I've made and I really do enjoy the course and the job.
My name is Salma and I'm an orthotist. So as an orthotist, we do a lot of gait analysis, which is looking at the way people are walking and trying to either improve their mobility and provide them solutions for people who have difficulty with certain areas. The things that we can provide are things like insoles, braces, whether that's knee braces, ankle braces, back braces, helmets, to a lot more complex things. So on a day-to-day basis, we'll be seeing patients throughout the day. Long-term patients that we have, young children from sort of under a year old to your really elderly patients, and we'll be again looking at the problem that they present with and trying to find solutions for their problems that will enhance their mobility and make their lives more comfortable. To get into the profession, you need a background in science and maths, normally physics. You'd need 3 A-levels. And the 2 universities in the UK that offer the course have slightly different requirements for those gradings. If you're coming in as a more mature student, then if you don't have a background in science and maths, often you'll need to do an access course just to get your subject knowledge up. We're a healthcare profession, so you have to come into the profession wanting to care for people. We do quite a lot of practical and hands-on work. You've got to be quite innovative and quick thinking, come up with different solutions, think outside the box and be a bit creative. The job role is quite specific. If you go to do a prosthetics and orthotics course, then you are limited in that you're either going to become an orthotist or you're going to become a prosthetist or go into management in those fields. People are often coming to you in a lot of pain. Their quality of life has deteriorated massively, and you're able to try and come up with solutions to try and help them. So number 1 would definitely be job satisfaction with seeing patients go away happy. You get a lot of job security with it, and obviously the pay that goes along with that, and there's a lot of scope for development in terms of pay grades as well. You can keep progressing, and with that obviously your pay packet progresses as well. So you come into work every day with seeing different people, different types of people, different personalities. You get to interact with lots of different types of people, and the teams you're working with, you've got this really good bond and you feel that you're part of something, especially when you're working within the NHS.
So I'm Rachel and I'm an occupational therapist. So I work with people to help them do things in daily life that sometimes they might find a bit hard, so stuff like getting washed or going to the toilet, so things we think are really easy, some people find really hard, so I help them to keep doing that and be more independent. I got into occupational therapy because I really want to help people, and I think when you really get to know someone, help them to be who they want to be and do the things that they really want to do. So on a day-to-day basis, I would look on the computer, see what patients the wards have referred to me, and then go up onto the wards and just generally chat to people, find out what's important to them, and then help them. So I kind of assess people getting in and out of bed, off the chair, if they need any help with personal care, and I kind of work towards those goals and what they want to do. And then start working on discharge plans. So we're heavily involved in getting people out of the hospital and getting them to be safe at home. We see a lot of patients in kind of different scenarios, different diagnoses, different things wrong with them, and then we just help them to get better. So on a day-to-day, so like on the mornings, we kind of help people with like getting washed and dressed, see what help they need at home. Around lunchtime, see if they need any help at lunch. I had to go to university and do a degree. So it's a degree in occupational therapy, and it's a science-based degree. So generally I'd say like GCSEs, A-levels, you're looking at anything to do with the sciences, health and social care. Like biology is really important as well. Occupational therapists can work with people that are elderly, the young, children, so being able to talk to anyone's really good. But also being caring, kind, being passionate about helping other people. So I think what's amazing about OT is that I work in a hospital, but you can work as an occupational therapist anywhere. So you can work in schools, in the hospital, rehabbing people, which is helping them get back to doing what they were doing after an illness. So like if someone's got a broken leg, you can rehab them to get back walking. And even like you can work with charities, and I think that's what I like about my job, is that it's got such a wide range of doing things, and you can get up to be like leading services and stuff like that. And I think it's just really nice to actually work see someone's journey, going from not being able to, struggling to get out of bed, to eventually being able to walk the length of a ward and go home, being really independent.
My name's Phoebe Kent, and my job title is Head of Children's Speech and Language Therapy at Royal Wolverhampton NHS Trust. Well, my job is managing the service at Wolverhampton, but for speech and language therapists generally, there is no way to describe a typical day because there is such a wide variety of things that you can do. You can be working with adults that have had a stroke, or children on the neonatal ward who are premature birth children who are having difficulties feeding and swallowing, and everything in between. You have to have a degree in speech and language therapy. Now that can either be an undergraduate degree or a postgraduate degree, and obviously to get onto the degree course you need to get the required A-level or equivalent results, which vary depending on which university you are attending. Being able to communicate with a wide variety of people is one of the most important characteristics, because we might be working with little children, you'll be working with their parents, you'll be working with teachers, working with a multidisciplinary team which could include physiotherapy, occupational therapy, doctors, nurses, across the board. So those sort of skills are very important. The sort of things that you study as a speech and language therapist include language and linguistics, medical studies, social sciences, and a huge range of different areas. It's quite exciting in speech and language therapy because you qualify as a newly qualified speech and language therapist, and you are qualified to work in any area of adults or children's speech and language therapy. Usually what people do, they come out of university thinking, I want to work in that area, But once they've been qualified for a few years and had a bit of experience, then they get more interested in a particular route and tend to go down that route. So for me personally, I always wanted to work with adults as a speech and language therapist. When I qualified and had my first job, I realised I wanted to work with children, and after a few years I realised that I wanted to work particularly with children with autism spectrum disorders. And then after a number of years doing that, I decided I wanted to go into management and do the broader, more strategic view of speech and language therapy. So people can really change in their careers and move into different areas. Job satisfaction within this career is immense, because what we do all the time is try and support people with a wide variety of difficulties, and those difficulties, as I say, can surface from a variety of different causes. So every day you're aiming to make people's lives better and improve their quality of life. So that is very satisfying. Pay within speech and language therapy is dependent on how much experience you have, how long you've been working, and also the level of speciality that you have. So for some members of staff who've done lots of additional training to work with eating and drinking difficulties, their pay will increase alongside the roles they get with that. The thing I love most about being a speech and language therapist is that no 2 days are alike. Every day is different. I meet so many different people from all walks of life, and it's just great fun being able to help people that really need us.
Hello, my name's Colette. I'm an ODP. ODPs are registered allied health professionals, and we're regulated by the Health and Care Professions Council. We're highly skilled, essential members of the surgical team. We provide individualised care and support to patients during their operative procedures. To become an ODP, you have to follow a recognised course. You need 3 to 5 GCSEs at grades A to C or 9 to 4, including maths, English and science. Diplomas are still offered until 2021, for which you need 88 UCAS points, or for degree pathways 112 UCAS points. Degree level is BSc Honours and takes 3 years. There are apprenticeship routes or fee-paying routes. On qualifying, you will be Band 5 and your pay will start at £24,907 a year. As an ODP, career opportunities include working at local, regional or specialist hospitals, in the NHS or private sectors, specialist clinical areas. You can be a surgical first assistant with further training, a surgical care practitioner, a physician's assistant, or you can follow roles in education and training, teaching, lecturing and management.
Hello there, my name's Stuart and I'm an ODP at New Cross Hospital. So a day in the life of being an ODP, you come into the hospital, you set up the anaesthetic room, you check the anaesthetic machines, you look at the patients, what patients you've got for the day, setting up drugs, getting the anaesthetic room ready for whatever lies ahead really with the patients. Another aspect of the anaesthetic practitioner role is putting the patients to sleep with the anaesthetist, and then it's transferring the patients into surgery ready for their operation.
As a scrub practitioner, first thing in the morning we check the theatre list to see what cases we've got. We set up all the equipment in theatre, we check our instruments and sets that the surgeon will need. As the scrub practitioner, I put on my mask and I go and wash my hands and put on sterile gown and gloves. I have to open my set and check all my instruments. I assist the surgeon in prepping and draping the patient. Throughout the surgery, I will pass instruments and anticipate the surgeon's needs. At the end of the case, we perform another check and count everything, and then I hand over the care of the patient to the recovery staff.
We monitor their airway, pulse, blood pressure until they are ready to return to the ward. We then communicate to the nurse and hand over the patient's care they have had in theatre. So it's a varied job. Different patients have different needs that require specialised types of equipment depending on their surgery. We are here as a team and communication plays a big part to ensure patient safety.
As you've seen, you don't have to be a doctor or a nurse to work in the health service. There's lots of amazing careers no matter what your ambitions and aspirations are. If you want a career that helps people, young or old, big and small, live better, then maybe an AHP role is for you. If you want to find out more about AHP careers, such as qualification requirements or the pathways available, there's loads of information on the Health Careers website, or you can contact us if you've got any questions about work experience, apprenticeships or careers at Royal Wolverhampton NHS Trust.